When someone is new to an organization or workplace, they often take time to settle in and learn the ropes before challenging the status quo and working to make improvements. Not so for Dr. Ramm Hering. In 2015, Dr. Hering completed a clinical fellowship in addiction medicine and shortly thereafter took on his current role as physician lead, primary care substance use with Island Health.
When I first finished residency, I was practicing as a family doctor and doing more and more inner city community health, community medicine, and doing a lot of addiction medicine. It became really clear that addiction is a huge issue for lots of people, and most people don't understand that addiction can actually be treated really well. And so seeing people who get treated well for addiction and recovery is something that really inspired me to go on to learn more about addiction medicine, to do clinical training in addiction medicine, and then to be able to have an opportunity to use the skills in addiction medicine to help address the opioid crisis.
In his first 18 months on the job, Dr. Hering advocated for substance use and addiction services for the most marginalized and vulnerable populations, and used his innate ability to secure buy-in among colleagues and administrative leaders to establish new addiction services where none previously existed or were very limited.
Dr. Hering is so authentic in his passion to express the need for increased addiction services for the vulnerable populations that he has worked with. He's been able to inspire other individuals. He really is able to capture the need and effectively influence other physicians, providers, and leadership for the need of these services.
Under Dr. Hering's leadership, Island Health opened an outpatient rapid access addiction clinic in Victoria, providing same-day access to treatment for clients living with opioid use disorder. Established an addiction medicine consult service, supporting clinicians and patients with addiction challenges at Royal Jubilee Hospital. Created an effective integrated work of opioid agonist therapy providers in Greater Victoria by improving the connections and working relationship between 5 disparate clinics. Provided support, education, and expertise to family physicians to increase their capacity and ability to deliver addiction services to their patients with opioid use disorder. And established an Addictions Medicine Fellowship satellite site for the BC Centre on Substance Use Addiction Medicine Fellowship Program.
Dr. Hering has inspired his own patients, colleagues, the organization he works within, and his local community, as well as other communities in BC. He is a true healthcare hero.
Dr. Hering, for inspiring your colleagues to work with you to develop new programs and services and create an efficient, client-centered system of addiction services, you have been named this year's Healthcare Hero for Island Health. Generously sponsored by Pacific Blue Cross.